Hello and welcome all. I'm Shalin Agrawal from the Financial Express. We have with us Dr. S Sharma, CEO of National Health Authority. Friends, if 10 years ago someone would have told you that solutions to India's health problems lie in digital technologies, you would have found it a little difficult to believe. But that's exactly what is happening today. Dr. Sharma, thank you for being with us.
Thank you very much.
Sir, if you could give an overview of how digital technologies is helping healthcare services provision.
As you yourself, first of all, thank you very much for inviting me to your channel. Secondly, I think this is a very important question which you are asking. And you yourself said that if 10 years back somebody would have raised this question, people would not have believed it. But today, technology is permeating almost all walks of life. India today has got 1 billion mobile connections, more than 1 billion. India has about 800 million internet connections, 600 million smartphones, and rising at the rate of 25 millions per quarter. And we have the cheapest data rate in the world. People are using mobile telephony. People are making video calls to their family members here and abroad. So that cheap the data is. So I think today you have a connectivity infrastructure, very, very massive infrastructure is there in the country. Secondly, this program was initiated, Digital India program, and you are now having the 7th anniversary, 7th not anniversary really, but I don't know what you call it, 7th sort of version or 7th year of that program. From 1st of July 2015, the Prime Minister launched that program. And that program also basically comprehensively set out a vision for India to become digitally empowered society and knowledge economy. And in 7 years, we have achieved so much that today there are multiple programs which are providing that kind of usefulness to the people. So in the Digital India program, you had connectivity at the base, then you had software and services on demand, and then you have citizens empowerment. So I think all these three phases or three vision areas have progressed quite a lot. And health is actually one area which we have realized during these pandemic times. It's an extremely important area. And we have now, willy-nilly started using technology, because at that time we were not allowed to go anywhere from our house. So we were making calls, we were making WhatsApp calls, video calls with our doctors, asking them for prescription. What do we do? What do we, we have got this problem, how do we solve it? So in a way, in a fragmented manner, people have started using digital technologies. If you remember the oxygen cylinders chaos, or the remdesivir vaccine, remdesivir injection problem. So I think digital has permeated the way things are happening. And what we are doing is essentially put that into a very formal framework where one could use digital technologies in a very systematic and transparent manner, so as to make these digital health services more affordable, more ubiquitous and quality.
Very interesting that you mentioned about connectivity. So this connectivity, what all stakeholders are there in the healthcare chain, and how is it that this technology, the technology brings all those stakeholders together?
Well, first of all, the stakeholders, as obviously we know, one is the patient. The patient is the most important stakeholder in this ecosystem. Then of course, this is the demand side part. On the service side part, you have hospitals, you have laboratories, you have doctors, you have pharmacies, you have drugs. So these are the supply side, sort of ecosystem stakeholders. Now, this is what we are doing in the Ayushman Bharat Digital Mission, which, as you know, was launched by the Prime Minister in September last year, 2021, is essentially creating building blocks which are using this whole ecosystem and connecting them. We are connecting the dots. And so therefore, for patients, we have the applications which can keep his or her longitudinal health records. So his lab reports, his prescriptions, his discharge slips, all kinds of things. For doctors, we have these same applications which can be, this data can be shared with the doctors. Similarly, we have a health professional registry, we have a health facility registry, we have drug registry. So all these registries are going to work to basically serve the patient.
So all these records, would those be stored somewhere centrally, or would those be stored at the
No.
patient end?
We do not, we have learned this, and we have, exercised this kind of architecture in Aadhaar, where you had the concept of a federated data architecture, where the domain data resides where it is supposed to reside. So essentially the patient's data will continue to reside in the hospitals or in his or her mobile phone. So in or digital locker or whatever sort of place he or she choose to put their records in. We are not going to collect the records. However, we have what is called the health information exchange and the consent manager, which is going to basically ensure that a patient is able to share his or her record with the doctor with a proper consent. So, because we believe that the health records are extremely sensitive and they should not be, sort of helter and skelter and everybody is able to have access to them. No, only the patient must have the control of these records wherever they are located. So, when they are located at, let's say, Apollo Hospital and a patient accesses them, they are available real time for visualization in his or her mobile phone. That's the architecture. And then of course if he shares with the doctor, then they become available at the doctor's mobile phone or the screen. So this is the way it is being done. We are not storing any records, we are just creating links, and we are linking these records with Ayushman Bharat health account of each individual, which is Aadhaar number. So basically these records are all linked to his or her Aadhaar number, and then he is able to share using this particular consent manager with the doctor.
Sir, we'll come back to the data protection in a bit. You said that in a scattered manner, people had started talking to doctors or technicians even earlier as well, and during COVID times we saw that that thing actually worked. Going forward, do you think technology and connectivity could that further minimize the need for people to physically see doctors?
Well, look, this is, I am not saying that it is minimizing or not minimizing. What I am saying is it offers an alternative to visiting physically. If you want to visit physically, you are absolutely welcome to visit physically, and if you require to visit physically, sure enough. Obviously, hospitalization cannot take place on a mobile phone. You have to go ultimately. Typically, what will happen is that if you go to a doctor first time, then you probably go to him physically. But then follow-ups can be done in a virtual manner.
Depending on the case.
Depending on the case. And typically in 90% of the cases, follow-ups are always, they can always be done virtually. So, I have seen cases where a person comes from Bihar. He comes to All India Institute of Medical Science. He, shows to the doctor, and, he has to wait and all that. There is a long queue. Now, then doctor says very casually, oh, come after 15 days. Now, this guy has two choices. One is that he stays in Delhi for 15 days, which is so expensive. Another is that he goes back to Patna or wherever he is from, in Bihar or Jharkhand. He goes back there, then travels again, spends money. So then if there is a possibility where he can just talk to the doctor, convey to him, doctor साहब मेरी तबीयत अब ठीक हो गई है, या मेरी तबीयत में ये प्रॉब्लम है, और उसकी diagnostic reports भी, if they can be shared, then it will make a lot of sense, because then it will reduce the expenditure of the person concerned. So what we are saying is, now this is something which can be done today in WhatsApp, but that's not a right manner. This is not a scalable stuff, because the doctor has to be convinced that this is the same patient, the patient has to be convinced the same doctor, and then it is being done in a very, very non-repudiable manner. So it is, a doctor can write a prescription which can be digitally sent to him. He can pay to the doctor through UPI. So all this transaction, we have all the wherewithal, we have all the products, digital artifacts to complete this transaction. We have a digital identity, we have digital payment system, we have the digital signature system. So all these components are there which will be used to make this transaction happen.
That's a very important point that you made, that it's not just sending reports over WhatsApp, it's a much larger formal ecosystem where there are so many components which make sure that the patient and doctor interaction remains formal on a formal channel. That's a very important point, sir. Sir, the Ayushman Bharat Digital Mission, could you tell us a little more about that? What is that mission? And
basically what we are discussing till now is only components of Ayushman Bharat Digital Mission. Essentially, the Honorable Prime Minister launched this mission 15th of August 2020, wherein he basically said that the Ayushman Bharat Digital Mission, at that time he called it National Digital Health Mission, it will be piloted in 6 union territories. It was piloted, and thereafter after successful pilot, it was launched in September last year. And that basically is a program whose overarching objective is to use digital technologies, leverage digital technologies to make the health services delivery more affordable, more accessible, and with certainly better quality. That's the broad objective. Now, to that end in view, we have created an ecosystem, we have created the building blocks which can make this happen. And these building blocks are using other building blocks which we had created in the last 1 decade or so: digital identity, digital signature, electronic KYC, authentication, e-rupee, all these digital locker, all these digital artifacts which are horizontal in nature, which can be used in any domain, be it health, be it agriculture, be it digital commerce. Those artifacts will also be used to basically combine them with the building blocks which I told you about. One is the Aadhaar, the identity or Aadhaar number account which holds all the records, and then second is the HPR, Health Professional Registry, HFR, Health Facilities Registry, Drug Registry, Consent Manager. All these building blocks will basically connect with each other and then make this transaction related to health services delivery possible.
So, will it help taking healthcare services further to tier 2, tier 3 and tier 4?
Sure enough, because you see, teleconsultation, the distance collapses. It doesn't make a difference whether I am sitting in Chicago or I am sitting in the next room. It is the same thing. So therefore, people from remote areas will be able to make this connection, number one. Number two, what we are doing is something more important and more transformational, and that is interoperability, which means that now you don't have to have a same application both sides. You can have different applications and they will still communicate with each other. So that is the concept of universal health interface comes in, whereby you will be able to search, you will be able to book, and you will be able to avail services in a completely interoperable manner, which means I may have a client application of any brand and the doctor may have application of any brand. They will be able to still communicate using the UHI protocol. So that's where we are actually going to the next level. One was a level of a platform. We are going beyond platform, what we call network, and that's what is really transformational.
What does a patient need to have at their end other than a smartphone? Do they need specific applications? Do they need specific platforms on which they can log in?
No. Basically, you must also understand that for a diverse country like ours, we don't need really, we need inclusive applications. We cannot, enable that, somebody who has got a smartphone only will be able to take advantage of this. So that is why our country has created what is called common service centers, one in each panchayat, so that people can go to that center and can then use various services in what is called an assisted mode. So a person doesn't have a smartphone, but he has access to the nearest, common service center in his panchayat, and he can go there and he can conduct the teleconsultation or other kinds of transactions from that place. So that's number one. Number two, we are not going to build applications. We are basically trying to integrate existing applications. So you may have a financial application on your mobile, you may have a Paytm, or you may have some other application, or Make My Trip, or any other application. They will all be able to have these nodes which can provide them health services also. So for example, today Paytm can take the money transfer, then Paytm tomorrow can have the health related, you can have the teleconsultation also. So that's the whole architecture of UHI.
So you headed TRAI for quite a while before this. What experience have you personally brought in, and how is that helping you do the work at National Health Authority now?
Well, one is that, my individual self really does not matter much, let me put it this way, because all this is a team effort. all of us at the National Health Authority are building these things. It's not S Sharma who is doing that. Similarly, at TRAI, I was a chairman. There is a board, regulatory authority, and there is a whole set of people. Similarly, I headed Aadhaar also. I was the CEO of Aadhaar to begin with for 4 years. There also it is a collective teamwork. But I think all these experiences, we bring the knowledge and realization that for a country like ours, you need solutions which are inclusive, multilingual, scalable, because you are not building it for a few million, you are building for a billion. So scalable, that is interoperable, based on open standards so that people can communicate, open APIs. These are some of the architectural overarching principles of the systems which can work in our country. So for example, Aadhaar is a digital identity which is 1.3 billion plus strong now. Then you have the TRAI, the telecom network. Telecom network is also 1 billion plus strong. I told you about that network in the beginning itself. And payment systems, which is also, we did about 6 billion payments last month. So these are some of the large scale things. So that's what I think, that is what is important, where we bring these large. COVID is a recent example. Now COVID basically has done about 1.98 billion vaccinations, and every vaccination record is available on COVID. You can download certificate, you can book appointments, you can know, you are reminded as to when your second dose becomes due, when your precaution dose becomes due. So those things are working. So these are the things which have to be designed, and therefore the design principles, I think we have now learned over a decade or so. We have learned these design principles for anything to work for our country, which is as diverse. There are 26 languages in our country, imagine. Which is the country in the world which has got 26 languages recognized by the constitution, and of course hundreds of dialects. So that's actually very, very important.
The one aspect, of course, is technology. Another aspect is the healthcare services provision itself. Even for telemedicine, sometimes it happens that you do need ground support of either registered medical practitioners or lab technicians. Do you think going forward, the healthcare provision that is keeping up the pace with the advancement in technology?
I think it's actually lot of work is being done. I certainly don't think that it's absolutely appropriate or adequate. There is a lot of work to be done ultimately technology is only an enabler. Please understand. If there are no doctors, no amount of telemedicine will be able to do any good to anybody. So obviously you need doctors, you need hospitals, you need nurses, you need pharmacies, you need all these ecosystem players, and I think a lot of work is being done there. Ayushman Bharat has got 4 pillars. One is the Ayushman Bharat Health and Wellness Centers, which are basically primary centers being built, and there are 150,000 of them at the whole country. They are being built. That's number one. They have been built also, and a lot of work is being done. Then of course you have infrastructure. Ayushman Bharat Infrastructure Fund, where you are building hospitals, medical colleges and stuff like that. Then you have Ayushman Bharat PMJY, which provides insurance and health assurance to 40% of India's population, which is about 50 crore plus. So that's the third pillar. And fourth pillar is Ayushman Bharat Digital Mission, which provides a digital connect to all these pieces of the provisioning as also the demand side. So I think that's what is a very comprehensive, holistic program of Ayushman Bharat, which our Prime Minister has initiated, and I think we are working. All of us are working in our own capacities to make that dream come true of providing universal health coverage to our country.
What is the future of healthcare in India?
Universal health coverage, as I said, that we will continue to work. We will continue to provide support to our people. We will continue to ensure that the poor people, a health episode does not become a catastrophe in their family lives so as to put them below poverty again. So that's something which is very important. The catastrophic health expenditures, they can be assured and financed by the assurance or insurance scheme. That's what we want.
Dr. S Sharma, thank you so much for being with us today. This is Shalin Agrawal signing off.